So this is part 2 of a 5-part series talking about Flex program evaluation. Thank you all for being here with us today. And I'm just going to cover a little bit about the center's background and why we're here today. And then I'm going to turn it over to John. So the center, nonprofit organization dedicated to sustaining and improving healthcare in rural communities. We focus on 5 core areas. You can read those there. Most of you are already familiar with the center, but we'd like to include this just in case you might not be. We also like to emphasize how important diversity, equity, inclusion, and anti-racism are to the center. If you would like to read a little bit more about what that means to us, you can find that on our website, linked there below. And of course, this project is supported with funds from the Federal Office of Rural Health Policy based in the HRSA. So we like to give credit to those friends. And why are we here today? So the purpose of the Flex program evaluation webinar series is really just to deepen state Flex program understanding of program evaluation. We hear probably almost daily at task that evaluation is really something that coordinators can use a little extra support on. It's difficult, it's hard to wrap your head around, especially if you don't have that kind of background. So we wanted to put this series together for you guys to really help you, especially as you move into your competitive NOFO that will be coming out very soon. So it's very timely. What to expect: each webinar will be 60 minutes. There will be a brief presentation on the day's topic by the Flex monitoring team and some of us at task. We'll have engaging conversation, usually some breakout rooms and an activity. Then there will be time for Q&A. And hopefully you get to apply the topic in each webinar. So you can see we had the first one on November 1st. That recording is available on the website, and you probably got an email about it. I think it was also in Rural Route. So check that out if you missed the first one. Here we are today, November 30th, and then please save the date for the rest of these, and you can see their topics. But we'll also be gathering some feedback at the end of this for what you might like to see in the remaining 3. So speaking of evaluation, please take just a moment to complete this pre-polling. Like I said, at the end of today's webinar, you're going to get a link to a survey. So there will be some opportunities for polling throughout the webinar, but we really want to get your input on how the first 2 webinars went, how you felt about them, and then what you might like to see for the remaining 3, because there's certainly an opportunity to take in some of your feedback if you have it. So it seems like on theory of change, most of you are moderately familiar with that. Several unfamiliars and slightly familiar, so that's good. We'll be able to help increase your knowledge there. Logic models, a lot of moderately familiar, that's great. Several of you are confident, that's awesome. One of you is extremely confident, I love that. Program evaluation, theory of change. Okay, so some similar results here with everyone's confidence level. So I think this will be a really educational session for you guys. And with that, I'm going to turn it over to John.
Thank you, Kayla. And can I advance these myself, or will I have you do that?
I can do that for you, John.
Thank you so much. Well, welcome to this next session. On behalf of Megan and I, we appreciate your time, and hopefully we will provide you with some information that you'll find useful as you approach the next competitive funding cycle. So we're going to talk a little bit about logic models and theories of change, and there are some of you who may find this as fascinating as I do. But it's an important set of skills, and we'll go over some of the key issues. So if you can move to the next slide, please, Kayla. So here's what we'll try to do today is really describe the role of theory of change in program planning, implementation, management, and evaluation. Thinking about moving from the theory of change to your logic model, which is part and parcel of some of the work you do as grantees, and then using both of these tools, the theory of change and the logic model, to support your planning across the Flex program funding cycle. And this is really a process of connecting the dots, for lack of a better way of saying it, by leveraging your interventions across funding years to demonstrate progress towards long-term goals. And this is an important skill. And then finally, connecting the interim activities to your long-term goals. Next slide, please. Well, I'll go over this fairly quickly. But I think what I've seen now over 25 some odd years of working with state flex programs and working and reviewing probably every single flex grant application that's been written in the last 25 years, that there are some common problems that at least I have been able to identify.
Challenges.
And the process of, what I call activity traps. You've been doing something for a long time. You do that particular activity, you've continued it, people seem to like it, but you're not surely why you keep doing it. And you may be doing the right things properly and implementing it according to plan, but are they the right things for the changing needs of your state and hospitals? People fail to target symptoms, not the root causes. Why are hospitals struggling? Not just that they have financial issues, but what's the underlying reasons for it? You can fall for the intervention of the month. Things get exciting. We've seen over the years cycles of different interventions, from lean management to Baldrige to balanced scorecards. And that's not saying that any of these things are bad, but you really have to pick the interventions that make sense for your hospitals. And then finally, not adapting interventions to the local context and not having a consistent strategy over time. And the most important part is, as you identify interventions, you've got to identify who has the power to make desired change. Next slide, please. So this is one that I like, a cartoon, and this sort of provides evidence of and an example of what we're talking about. These folks need to get across the water, and they immediately start by building a bridge, and then suddenly realize part of the way through that they perhaps needed a boat instead. And this is what's so critical. Understand what your problems are and the scope of the problems before you try to move to an intervention. So the essential part is really understanding what's going on. Next slide, please. So and to sound academic, we articulate the assumptions about the process through which change will occur and how will those outcomes be achieved and documented. It's really a map or causal pathway. You look at outcomes that you hope to achieve based on the problems you're seeing among your hospitals, among your EMS agencies, and then sort of looking at what it takes to get there. And then you create a roadmap. I call it a triptych, which most people don't remember from the AAA days, but it's really a step-by-step process that moves you forward. If you run into problems, you run into things that require an adjustment, you have that goal of going back, you know where you're headed. So it lets you identify interventions and assumptions that are critical to producing an outcome. And it highlights the critical areas by addressing the external actors. And we'll come up with, I'll provide some examples as we go, but how you link to them. And Penny knows what a triptych is. Thank you very much. I know I've got one of you. It's not a common example anymore now that we have phones. Next slide, please. So here's what a theory of change can do for you. It helps you to, it's really a thought process. You understand your interventions better. You clarify changes in your interventions over time. The perfect example of why theories of change are important was the recent COVID pandemic. It upset a lot of what was happening at the state levels, not the least of which was a complete reorganization of priorities in many state flex programs based on the needs of their hospitals and EMS. It informs your evaluation questions and improves your chances of developing buy-in for your evaluation and findings. So this is critical to how we move forward. Next slide, please. And you have multiple levels of analyses, and I think it's important to go through them. Always start with your problem analysis. What are the situations? What are the needs and assets? What cause and effect? Really get a handle on the problem that you're trying to solve. Then it's stakeholder analysis. Who are the folks you are trying to impact? What are their priorities? What are their resources? What are their perceptions of need? And if we're all being honest, every one of us has implemented a program at some point, which we thought was great, targeting different people, and the stakeholders had a very different impression. So this is not an uncommon problem. So you really want to bring them into the process. Then look at, how do we solve the problem? What are the strategic alternatives? What are the assumptions? We look at improving the finance of hospitals, and you have a long-term goal of increasing their margins. There are things that happen that are outside of your control, and those external factors have to be accounted for. COVID is the example, but we've also had states that there have been major changes in their payer mix and their payment policies. On the positive side, we've seen states that have adopted Medicaid expansion, and that has made a difference in their long-term finance. And then what are the opportunities to make changes? What resources do you have? Do you have the people in place that can do the work? Do you have contractors that you can work with? So this is really the sort of foundation on which you build a theory of change. Next, please.
So this is our second round of polling. I promised you would have several opportunities. So we don't usually do like little pop quizzes like this, so I apologize for that, but just a little knowledge test. So take just a moment to answer the 2 questions. And I can't see what you answer, so total anonymity, don't worry about getting it wrong.
So as you sit down and begin the planning process, and this planning is such an essential element, it's important to evaluate what it is your theory of change. Does it make sense? Will it lead to the changes you want? So look at the chain of events that lead from intervention to the next intervention to desired outcomes and impact. Are these outcomes sequenced properly? Say if you're doing a revenue cycle program, and you're looking at improving your days in cash or reduce the days in AR in accounts receivable, but you've got your coding classes after that step, you're out of sequence. So it's building a step-by-step ladder, staircase, map, however you want to look at it, that moves you along in a logical fashion. And do they connect together? Are there leaps in logic or missing elements? Absolutely, that happens. We've all done it. We get so excited about the change, and I've done it myself, that you want to jump to the high level changes without looking at the steps along the way. And are all the necessary outcomes there that others are responsible for included? Do you have sufficient time and resources? Are there roadblocks along the way that may impact your ability to move forward? And do you have the participants and the right participants engaged in the process? I will always say that this is really the critical piece, and we've seen this so many times, that we have great ideas, but if the people we work with may have different ideas along the way about what's important. So it's very critical that we bring them into the mix. Next, please, Carol. Thanks, Kayla. So we're going to move, and the theory of change and the logic models aren't necessarily the same thing. So when you move for the theory of change, this is how you sort of capture the step-by-step process that you can share with your stakeholders, you can share with the federal office, with each other, and build the foundation of your evaluation activities. It illustrates your thinking and your logic behind what you're trying to do. It links the assumption and principles of the program, the activities and processes, and the outcomes. And they provide the triggers that will show you how your work can be monitored and evaluated. And the key things to consider. Do you have consensus between stakeholders over what the basic problem is? You may not always have that, and this is a very difficult thing to do. But it's important that you get there, that we all know we're trying to solve the same problem. And then have you formulated the problem so that it can be addressed by your interventions? And next slide, please. So here are a couple of ways of looking at the theory of change. the theory of change is your logic that says if we do X, then Y will change. And if you're doing this over the course of the funding cycle, then maybe we will do X and then Y will change, and then we do Y and then Z changes. And so this is really explanatory. The logic model is description about what you're doing and setting those goals and establishing what we expect to happen. You always start with what is your goal, which is based on your problem, and then work backwards to a solution. Logic models are often, however, from the bottom up. And so if you're trying to move, you're constructing them in a different fashion, but you're getting to the same place, which is really providing you with a framework for understanding what you're trying to do. Next, please. You have some of the benefits. It provides a logical link between means and ends. You can measure those links and measure the progress. It puts your activities within the broader development environment. And this is so critical because we've seen this many, many times. You've got to be aware of what can go wrong in between, what can happen. COVID is a perfect example, but we had a hospital in Maine that the day it got its critical access hospital designation, the major paper company, which was the major employer and source of commercial insurance, closed. None of their financial goals and expectations were met as a result of conversion because of that. Didn't mean they weren't doing a good job, but it does mean that you have to be aware of these things. It looks at your risks, requires an analysis of whether objectives are measurable. That's always a tricky one. Establishes the monitoring and evaluation framework, links the problems to your analysis to your objective setting, and it provides a simple way of explaining what you can do and does it in a participatory way so you can engage your stakeholders in the process. It gives them something they can look at and react to. Next slide, please. So some of you may have seen this before. We've used this one. It's planning starts with the end goal in mind. So you work backwards and then you establish the situation. What are your priorities? What are the resources you have? Staff, volunteers, time, money, can be external contractors. Then what do you want to do? Who are we reaching? And then a step-by-step process of what the goals are. So it's a very visual way, and if you can keep it simple, which is always difficult, it's very helpful for engaging the stakeholders. Next, please. So some of the challenges: getting your consensus on your objectives, reducing those objectives to a simple linear chain, an inappropriate level of detail, too much or too little. We've all seen logic models you can't make head and tails of, or some that have too little information to really quantify what you're trying to do. Finding the measurable indicators for the higher level objectives, and then setting realistic targets. We can't expect change that quickly, primarily because this is a complex environment in which many people are working with and impacting hospitals. Federal payment policies, commercial payment policies, state government, state policy issues, local economic conditions, all have an impact on how far you can go. And it links and it makes sure, it gives you a way of saying our problem analysis and our objectives are linked in a way we think is reasonable, doesn't marginalize risks. And it does provide the need. It requires a demand for training and judgment. And again, I think this is a skill set that many of us who work and do project work, we're always cultivating. This is an ongoing learning experience. Next, please. So dealing with complexity, and these are, I found this slide from an article on dealing with assumptions through a complexity lens. So I'm going to go through each of the examples. The first one is very simple. It shows a fairly straightforward path from one step to the next to a desired outcome. But it is how we typically do logic models. And it's problematic because it doesn't allow for any of the contingencies that come into place. And if you look at the pink model on the bottom, it assumes all of these things are going to happen in a logical fashion. So we're going to do the first step, then we get to step 2, then we get to step 3, and while it's better than the first level, it's not necessarily accurate. And that middle bluish colored graph is really where you need to be. You need to think about what's going on and have alternatives, because as we all know, in many of our projects, things change along the way, and you need to be able to look back as part of your evaluation process and decide, we're not achieving the goals we thought we were. Why not? Is it participation? Is it something else going on in the environment? And then adjusting your course appropriately to always move incrementally towards your desired outcome. Next, please. And then these things aren't linear. And it is a feedback process. So you start with inputs, outputs, outcomes, you have program investments, activities, participation, and you always really should be thinking about who you reach, what we do, what are the results, and cycling back as you accomplish some goals. Maybe it didn't move you far enough along, maybe it leapfrogged you ahead, but using these feedback loops as part of your program management as well as your program evaluation is really important. Next slide, please. We have another check-in.
If we have, I think this is our last polling other than the survey. So again, apologize for the pop quiz, but just take just a few moments to match these terms. Promise this will be the last quiz that you have to take today.
Yeah, it looks like everyone's giving the right answers. So
Yeah,
inputs are what we invest, outputs are what we do and who we reach, and the outcomes are the results that we have.
awesome. Thanks, guys.
So we'll do just a few more things, and I'll move through these quickly so that we can go into the breakout rooms. Always check your logic model, and it's very, very helpful to have someone outside of your normal group process to develop a logic model to take a look at it. I find whenever I work on something, it's really helpful to get someone outside who isn't as tuned into where I'm going, or I think I'm going more accurately, to provide some feedback. So sharing it outside of your group, maybe sharing it with the stakeholders for whom you hope to engage participation is really helpful. So is the model meaningful? Does it make sense? Is it plausible? Can you do it in a reasonable period of time? We all I'll be the first to admit I tend to bite off more than I can chew some days, and it's not an uncommon problem. We want to make change. Can it be verified? Have your targeted participants agreed to engage in the intervention and report data? And I can then, I think, share this with your program development committee, your partners, your evaluators, participants, and others to get that feedback and input and make the necessary adjustments. So next slide, please, Kayla. So here's the piece, and they all laughed at me a few weeks ago when we were doing this during an evaluation meeting. But the key piece to this for me in terms of influencing your thinking is, how do we move across the funding cycle? Let's not look at it's helpful if you can and you have the resources and you have the right level of participants to move across the funding cycle. It's the old joke about how do you eat an elephant? It's bit by bit and one bite at a time. And, that's how we have to look at these. The problems experienced in rural communities by CAHs, their community leadership systems, their EMS agencies are complex and evolved over time. And these are not things that we can do with one or two initiatives. So having a long-term view, thinking about how you move forward and you tackle these things in stages is just such an important way of thinking about this. I'm a Catholic schoolboy. So I always go back to the Franciscans who trained me. But I love this quote, is that you start by doing what's necessary, then you do what's possible. And suddenly over time, you find you're doing the impossible. And this is that building block process. Please save yourself the frustration of thinking we're going to go from 0 to 100 in 10 seconds. It's these, if you break it into manageable stages, manageable chunks that you can do within the year, you're realistic about what can be done. Building on activities. So if let's go back to the revenue cycle. You fix the coding issues, charge capture. Maybe you've done some initial work around charge masters. And then you can start looking at what is your system? Why are claims being denied? Are you being paid at the right levels? And over time, you're going to show that movement towards improved cash flow and management, which in the long run will impact margins and financial viability. And it helps you develop, those coherent activities across the funding cycle. If we can go to the next slide, please. I think we have just 2 more. So this gives you the example of the revenue cycle that to me is among the easiest of ways of conceptualizing sort of this longitudinal step-by-step process. So you have pre-registration, patient comes in, you collect the insurance information, you make sure they have insurance and that you know what the numbers, the proper identification is, you've collected what you need. Is there a pre-approval process? All of that. You register the patient, you get them into your management information system. You provide a service, and then how do you capture those charges? You'd be surprised how many times charges are not captured properly. You maybe miscode it too low, too high, all of which can create problems. You submit your claims, and we all know that many insurance companies, part of their job is to deny claims. So if you have any glitches in your claim form, they may deny it. Then if you get the claims back, then you process the remittance, you apply the cash, make sure that it's done correctly. If they've denied it for reasons that are inappropriate, you have to resubmit. That means spending time with the insurance companies, collecting payments, advocating for revisions and recollections. Then at the end of the day, you'll have patient copays and deductibles. Do you have a clear process to collect that? And it's just one big cycle. And it's, again, I think it argues really easily for the step-by-step approach to looking at revenue cycle management. But you can do this with other activities in terms of thinking about population health. So say you want to address chronic care management. You have to have a process for identifying patients with chronic care management. You set up your patient registry. You perhaps have a screening process. You make sure that information gets into your system. You create the programs. But again, much of what you'll be doing can be distilled to a longitudinal process. Finally, I think this is our last slide. And this talks a little bit about that circle of revenue cycle management that we talked for. It's a foundation. So I don't think we need to spend too much time on that, but just think about those steps along the way and how and the order in which you begin to develop interventions that may address a problem within each of those levels. Doesn't do you any good to look at pre-collection, pre-service and service insurance verification and authorization if you're not capturing that information up front. So think about how these things transpire in a healthcare setting to move you forward. And I think that is a very good way to begin moving the process along. I think we're set, Kayla. That's the last slide.
Yeah, so I'm going to stop sharing, and Caroline's assigning everyone to a breakout room. You'll have a facilitator in there that will walk you through the activity. And we will come back in here and there will be an opportunity for questions and we'll do a brief report out.
Some of you will be staying in the main breakout room with me. The slides for this session and the last session and all future sessions are available on the center's website. I'll put a link in the chat to the event page in just a second. Thanks for asking though.
So we just wanted to get a very quick report out because we want to give you guys a few minutes for questions. So if each of the groups could just like quickly say, for which of the programs areas are you most interested in having additional resources for supporting the development of theories of change and or logic models? I know that's a little bit of a confusing question, but are there additional resources that would be helpful for you guys as you work through this evaluation process? And this is the last polling, I promise. Other than the survey that we are going to hope that you do.
Kayla, I think the hands-on stuff is really helpful. And as many people who can probably relate, you don't always learn it the first time. I think doing the hands-on exercise sometime again would be super awesome.
Good to know, Liz. Thank you. We weren't sure if you guys would enjoy this or not, so that's good to hear. I appreciate that. And we even talked in my group about using Mural. And I said, if anyone wants to use Mural or familiarize themselves with it, everyone on task is pretty adept at using it, and we would be happy to help you with it. Awesome. Perfect. Thank you guys for doing this polling. Thank you, Jody. Okay, any questions? I know we've got just a couple minutes left, but
I have a question that will not be answered here today, and I'd like to pick the brains of people who've been doing this for a while, Scott Daniels. How do you make time for this kind of logic model thinking in the midst of flagship and the state legislature stuff you're doing and everything else? I know, right? There's not a real answer for it. And I'm finding myself going, I mean, I've been drilling in the back of my head all year, kind of doing a logic model internally about Flex. But it's hard to find the time to carve that out, to really do it. So I will take any suggestions from anybody.
And while everyone is thinking of an answer for Liz, please click on that link and fill out that feedback form for us so we know things you want to see in the future. But I did see Scott came off mute. So Scott, what do you got for us?
I was going to say, if you're thinking about it on your spare time, then eventually it'll just be something that you start doing. It's I mean, I don't know that I guess I set aside time when I start writing the grant and start sort of thinking about what do I want to accomplish, and so it just becomes part of the way that you do things.
So I guess I'm already doing it and didn't realize it. So that's good.
Yeah, to add on to what Scott said, because there was so much pushback in our office at the beginning when we really started doing evaluation, and until it became just part of the workflow and wasn't considered extra work, it was a real challenge. But now it's just the standard operating procedure. If a new project is proposed, what is the need? What is, what are the resources available? And what is the realistic reasonability? I can't think of the word, but how realistic is it to achieve the outcome? So it just becomes part of the process, and it's not extra time that has to be carved out, but it takes a while to get there. Like John said, you can't go to 0 to 60, overnight.
One thing that's helpful is all of our contracts are now required to have outputs and outcomes, which is pretty cool. I'm liking that. And that's,
So I mean, you're moving in that direction. I mean, it just takes time. The more you deal with it, like I said, or as Penny said, it's it takes time, but pretty soon it's not like you're setting aside time to do a logic model. It's just something that you do.
right. So I'm already doing it. I just didn't think, because I wasn't being granular about it on paper.
Right.
You know what I mean? But this whole year it's been back here.
There's the formal process, and that's sort of what we did in the breakout groups. And then there's sort of the informal process, and I would say I don't do formal logic models. I don't put down a grid or stuff, but it's just sort of the way you sort of think after sort of a while, that here's what we want to do. Here's the outcomes that we want to have happen. How do we get there? And then you start slotting things,
Right,
start about how you get there.
Thank you.
Mhm.
Well, thank you all. We hopefully will see you on the next one. That's Tuesday, December 12th at 2 p.m. Central on accessing and analyzing data for decision making. Again, if you have feedback for specifically what you would like to see for that next one or the remaining ones, please let us know. If you have questions in the meantime, you can contact Task or John or Megan. We're all happy to help you.
Hey,
But-
Kayla,
Yes.
is it
Laura.
possible, I assume everybody had the same activity in the breakouts, right?
Yes.
Can someone take a screenshot of it and post it with the slides? Because I know in my room, everybody wanted to have a copy of that.
Perfect. Yeah, we can put that in the slide deck. And I said that we can also put the link to the mural. That should be fine if you want to access it later and just look back on what we did. So yeah, we can definitely do that.
Perfect, thanks.
Yeah. Thanks, guys. Have a great rest of your day.
This
Thanks.
was